And that also refers to the way in which we financially support asylum seekers and the way in which we house them. So when it comes to Napier Barracks, the provisions have been put in place in terms of welfare, catering, accommodation, cleaning, laundry facilities, also NGO support as well, along with other recreational facilities such as yoga classes, but also providing migrant helplines as well. Now, that is all in line with our statutory duties and responsibilities, so I simply do not agree with the representation of the Honourable Gentleman.
Thank you, Mr. Speaker. This year, more than 3,500 men, women and children have illegally crossed the Channel after paying thousands and thousands of pounds to evil human trafficking gangs. If the Home Secretary was the President of France, wouldn't she be totally embarrassed by the complete failure of the French government to properly look after asylum seekers in France to such an extent that they risk their lives to flee France to get to England?
Well, my honourable friend makes a very, very important point, and we are working with our French counterparts. I'll be very clear about that, Mr. Speaker. However, we should also recognise that, of course, upstream migration flows into France are a serious, serious issue. But, of course, asylum seekers should be claiming asylum in the first safe country. That does include France. It includes many other EU member states who, obviously, because of the open borders policy across the EU, they are just transiting through. But our French counterparts absolutely must do more, and we are constantly impressing this point upon them.
Thank you, Mr. Speaker. In January, I asked the Home Secretary about Napier Barracks, highlighting the unsafe, inhumane conditions. The Home Secretary told me, and I quote, to listen to the facts. Well, here are the facts. On Thursday, the High Court ruled that the conditions were unlawful. Described as squalid in court, evidence suggests that PHE guidance was not and is still not being followed. So I asked the Home Secretary, how many people are currently sleeping in each dormitory? Why is PHE guidance still not being followed? And why did she claim that the standards were very high when they were unlawful? So,
that is absolutely incorrect in terms of the misrepresentation from the Honourable Lady. I've already made it abundantly clear that I have been vigorous in following and making clear that we need to protect public health and stop the spread of the virus. And not only that, I make no apology for doing everything in my power to fulfil our legal duties, to provide, by the way, shelter to people who otherwise would have been destitute, provide accommodation to people who otherwise would have been sleeping in dirty makeshift tents in France and in European countries on the streets, to provide them with beds, food, clean sanitation, access to healthcare, access to welfare provision. That is not putting forward squalid conditions.
Thank you, Mr. Speaker. The Home Secretary will know that I am a steadfast supporter of hers, but I do now need her help. How can I explain to my Dudley North constituents, and indeed to my honourable friends in Dover, that the repeated images of border force vessels bringing illegal immigrants to our shores, that judges ruling that army barracks are not good enough for them when they are for our brave armed forces, are events aligned with taking back control of our borders and laws?
Friend makes a very, very important and, in fact, poignant point about some of the reforms that we'll be making through our new plan for immigration, which will absolutely tackle many of these issues, bringing in a one-stop shop, stopping the repeated appeals that we face again and again, which stop us from actually removing individuals that should not be claiming asylum in the United Kingdom or who should not be here, who are here illegally. But fundamentally, these reforms, and they come through the House, Mr. Speaker, will absolutely set the tone for reform of our asylum system, but actually send a very, very clear message to those seeking to claim asylum and come to our country illegally that they should be doing so in first safe countries and not taking dangerous and perilous journeys across the Channel.
Can I just say I really am disappointed that we only got 10 questions in within 15 minutes. All members deserve an opportunity to get the question. I hope those members who took longer than normally expected will think about others next time. So please, front bench, we need speedy replies. Thank you. We're now going to suspend the House for 3 minutes to enable the necessary arrangements to be made for the next business. Order. Before we move to statements, I want to say something about the selection of amendments and new clauses for the Advanced Research and Innovation Agency Bill. I told the House in my statement on the 29th of January 2020 that as Speaker of the House I am committed to transparency and I respect and trust the advice from clerks in this House. As the House will know, and as Erskine May states, the Chair is not expected to give reasons for the decision on the selection of amendments. However, on an exceptional basis, I want to say something about why new Clause 4 has not been selected. I am doing so on this occasion because of the high level of interest in the new clause in the House and outside it. Amendments and new clauses which are not within the scope of the bill are out of order. Erskine May states, the scope of the bill represents reasonable limits of its collective purposes as defined by its existing clauses and schedules. In this instance, having taken advice from the House's senior clerks and the Officer of Speaker's Council, I have deemed that new Clause 4 to be outside the scope of the bill. New Clause 4 is therefore not selected and may not be debated today. I do wish to make a further point. As we all know, the Government has, through our standing order, significant control over the business of the House and considers on any given day. Its control is particularly strong when it comes to the initiation of public expenditure. Under the International Development Official Development Assistance Target Act 2015, it is the duty of the Secretary of State to ensure that the target for official development assistance to the amount of 0.7% of gross national income is met by the United Kingdom each year. Up until now, however, the House has not, and I repeat, not had an opportunity for a decisive vote on maintaining the UK's commitment to the statutory target of 0.7%. I expect that the Government should find a way to have this important matter debated and allow the House to formally take an effective decision. I should say that on an exceptional basis, I will consider whether to hear any standing order number 24 applications by 5:30 today for debate to be held tomorrow. Applications should reach my office by no later than 5 o'clock this afternoon. Having taken this exceptional step of explaining my decision and selection, in this case, I will only take one point of order, and that is from the lead member for the proposed amendment, Andrew Mitchell.
Yeah. Thank you very much, Mr. Speaker. Further to your statement, of course, I completely accept that you are the referee on these matters, and that is that. But, Mr. Speaker, the government front bench are treating the House of Commons with disrespect. They are avoiding a vote on the commitments that each of us made individually and collectively at the last general election, on a promise made internationally, and in the opinion of some of Britain's leading lawyers, the government is acting unlawfully. Mr. Speaker, had we secured a vote on the new clause tonight, I can assure the House it would have secured the assent of the House by not less than a majority of 9 and probably of around 20 votes. Mr. Speaker, in the week of the British chairmanship of the G7, the government's failure to address this issue will indisputably mean that hundreds of thousands of avoidable deaths will result. It is already attracting criticism from all round the other members of the G7. What advice, Mr. Speaker, do you have for my right honourable and honourable friends and I to seek to stop the government from riding roughshod over Parliament in this way and seeking to thwart our democratic rights as members of the House of Commons?
Can I first of all thank the right honourable member for giving the courtesy of giving me advance notice of this point of order. On the first point, that the government may have behaved unlawfully, I have to advise him that that will be a matter for the courts to determine, not me, as he's well aware of, and I know that he will work very hard at looking at that if that was needed. On his more general point, I've already expressed my view that the House should be given an opportunity to make an effective, and I repeat, an effective decision on this matter. I've also indicated that I will exceptionally be prepared to accept an application today for an emergency debate tomorrow. And I would say, I share the House's frustration. it is quite right that this House should not continue to be taken for granted. But we must do it in the right way, and I believe the government need to respect and need to come forward. I totally agree with the honourable member. Not only for this House, but the country needs that this is debated and heard and an effective decision taken. I now put that on the record and hope the government will take up that challenge and give this House its due respect that it deserves. We are the elected members. This House should be taken seriously and the government should be accountable here. So I wish and hope very quickly that this is taken on board. I don't want this to drag on. And if not, we will then look to find other ways in which we can move forward. I'm taking no more points of order. Right, before I call the Secretary of State, I would like to point out that the British Sign Language interpretation of the statement will be available to watch on Parliament TV. I now call the Secretary of State, Matt Hancock, to make the statement.
Thank you very much, Mr. Speaker. I'd like to update the House on our work to beat this pandemic and to make sure that the world is prepared for the pandemics of the future. Tomorrow we mark 6 months since the world began vaccinating against COVID-19 in Coventry Hospital. And in that time, we have vaccinated over 40 million people here in the UK, and 2 billion doses have been delivered across the globe. As of today, 76% of UK adults have been vaccinated at least once, and 52% of adults have had 2 jabs. The pace of the vaccine rollout has been extraordinary. This Saturday alone, the team delivered over 675,000 jabs, and I'm delighted to be able to tell the House that from this week we will start offering vaccinations to people under 30, bringing us ever closer to the goal of offering a vaccine to all adults in the UK by the end of next month. From tomorrow morning, we will open up vaccination to people aged 25 to 29. Over the remainder of this week, the NHS will send texts to people in these age groups, and of course, GPs will be inviting people on their list to come forward. I'm sure that we've all been cheered by the images that we've seen of so many eligible young people coming forward and lining up to get the jab, showing that the enthusiasm for the jab is not just the preserve of older generations. People of this country know what it takes to keep themselves and the people around them safe. The latest estimates indicate the vaccination programme has averted over 39,000 hospitalisations and over 13,000 deaths. So the vaccination brings us hope, and I'm sure the whole House will join me in thanking people for their perseverance and patience as they've waited for their turn. Mr. Speaker, for all this great progress, there is no room for complacency. The Delta variant, first identified in India, has made the race between the virus and this vaccination effort tighter. Although the size of the growth advantage of the Delta variant is unclear, the recent best scientific estimate is of an advantage of at least 40% over the previously dominant Alpha variant, the so-called Kent variant. The Delta variant now makes up the vast majority of all new infections in this country. Over the past week, we've seen case rates rise, particularly in the northwest of England. But we know also that our surge testing system can help hold this growth. In Bolton, case rates over the last fortnight have been falling, and we've expanded the approach taken in Bolton to other areas too, and we'll roll out to other areas as necessary. I also want to encourage everybody in those areas to get the tests on offer. No matter where you live, regular tests can help keep us all safe. And we know that the test, trace and isolate system has a vital role to play in keeping this all under control. Of course, the most important tool we have is that vaccination programme. We know that the vaccine is breaking the link between infections, hospitalisations and deaths, a link that was rock solid back in the autumn. Despite the rise in cases, hospitalisations have been broadly flat. The majority of people in hospital with COVID appear to be those who haven't had the vaccine at all. And I want to update the House on some new information that we have on this. As of the 3rd of June, our data show that of the 12,383 cases of the Delta variant, 464 went on to present at emergency care, and 126 people were admitted to hospital. Of these 126 people, 83 were unvaccinated, 28 had received one dose, and just 3 had received both doses of vaccine. We should all be reassured by this because it shows that those vaccinated groups who previously made up the vast majority of hospitalizations are now in the minority. So the jabs are working. We have to keep coming forward to get them, and that includes, vitally, that second jab, which we know gives better protection against the Delta variant. Mr. Speaker, the confidence in our jab comes from the fact they're working and the knowledge that they're the best way out of the pandemic. No one wants our freedoms to be restricted a single day longer than is necessary. I know the impact that these restrictions have on the things we love, on our businesses, on our mental health. It is still too early to make decisions on step 4. The roadmap has always been guided by the data, and as before, we need 4 weeks between steps to see the latest data and a further week to give notice of our decision. So we'll assess the data and announce the outcome a week today on the 14th of June. I know that these restrictions have not been easy, and with our vaccine programme moving at such pace, I'm confident that one day soon, freedom will return. To do this, we must stay vigilant, especially at this time when school children are returning to classrooms after the half-term break, and when we're seeing the highest rises in positive cases amongst secondary school-aged children. So with schools returning today, it is vital that every secondary school-aged child takes a test twice a week. This is to protect them, it's to help keep schools open, and to stop transmission. This is crucial to stop the spread and to protect the education of your peers. While the evidence shows that the impact of COVID on children is usually minimal, we also know there is higher transmissibility among children. So the message to all parents of secondary school-aged children is please get your child tested twice a week to help keep the pandemic under control and to help on the road to recovery. The House will also be aware that our independent medicines regulator, the MHRA, has conducted a review of the clinical trial data for the Pfizer-BioNTech jab. Having already concluded that the vaccine is safe and effective for people over the age of 16, they've also now concluded that the jab is safe and effective for children aged between 12 and 15 years old, with the benefits of vaccination clearly outweighing any risks. So I can confirm to the House that I have asked the JCVI, the committee that advises us on immunisations, to come forward with clinical advice on vaccinating 12 to 17-year-olds. And we'll listen to that clinical advice just as we have done throughout the pandemic. Mr. Speaker, people in this country know that vaccines are the way out, but this pandemic won't be over until it's over everywhere. This week, the Prime Minister will host G7 leaders in Cornwall, where he'll work to persuade our allies to join the UK in our historic commitment to vaccinate the whole world against COVID-19 by the end of 2022. The Oxford AstraZeneca vaccine has already proven to be a vital tool in this effort, with more than 500 million doses now released for supply around the world. And crucially, it is delivered at cost. In my view, this approach, providing vaccines at cost, is the best way to vaccinate the world. And I believe that developing a vaccine and allowing countries to manufacture it at cost is the greatest gift this nation could have given the world during this pandemic. Mr. Speaker, ahead of this week's G7 Leaders Summit, I met with G7 health ministers and guests from some of the world's largest democracies in Oxford. Our new clinical trials charter, agreed in Oxford, will help end unnecessary duplication of clinical trials, ensure greater collaboration across borders, and the result will be faster access to approved treatments and vaccines. We reached agreement with industry leaders to cut the time it takes to develop and deploy newer diagnostics, therapeutics and vaccines to just 100 days. And Mr. Speaker, I believe that as a result of what we've agreed in Oxford, there are people who will live who otherwise might have died, and I can think of no greater outcome than that. So, Mr. Speaker, in summary, beating this pandemic is an international imperative, but it continues to be a domestic duty that falls on each and every one of us to keep up the basics like hands, face, space and fresh air, to get regular tests, and of course, when you get the call, get both jabs, because that's the way that we can stop the spread and get out of this and restore the freedoms we hold dear safely and together. And I commend this statement to the House.
I now call Shadow Health Secretary Jonathan Ashworth.
Thank you, Mr. Speaker, and I'm grateful to the Secretary of State for advance sight of his statements, and I'm also grateful that he's confirmed that the government's approach continues to be driven by the data, not dates. We do face, as we often have done throughout these last 15 months, some uncertainty, but we do know that the Delta variant is now the dominant variant in the UK. We know that 73% of Delta cases are in unvaccinated people. We know that one dose offers less protection against this particular variant. And although hospitalisations are low, we know that if they see an increase in hospitalisations, that will have put significant pressures on the NHS as they're trying to deal with the care backlog. And we also know, of course, that long COVID is significant and debilitating for many people. Now, Mr. Speaker, I am an optimist, and I strongly believe that vaccination ultimately is our way through this. So can I ask him whether he's able to go further on vaccination? Is he able to do more to drive up vaccination rates in those areas that have seen the Delta variant take off and where uptake remains low, such as Blackburn or my own city of Leicester? Is he able to narrow the time frame between the first dose and the second dose, given that we know that one dose is not as protective as we would like? And you'll have seen that Wales are now vaccinating everyone over 18 from next week. Can he tell us when England will follow? Yesterday he talked about the outbreaks amongst school children and young people, and we know that children can transmit the virus and that children can be at particular risk of long COVID. So in that context, can I ask again why mask wearing is no longer mandatory in secondary schools? I'm pleased that he's asked the Joint Committee to look at vaccination for children. It's something I've pressed him on a number of times at the dispatch box. Can he give us a time frame on when he expects the Joint Committee to report on that front? He talks about the G7, and this pandemic has certainly shown that in an interconnected world where climate change and biodiversity loss drive zoonotic spillovers, working internationally to prevent future outbreaks is in our interests. None of us is safe until all of us are safe. That is not a slogan, that is the fact of the situation we are in. So that means working internationally. For a start, that means not cutting international aid, Mr. Speaker, but it also means working globally on our vaccination efforts. He'll have seen today that Gordon Brown and Tony Blair and other ex-world leaders have put forward a G7 burden sharing plan that would vaccinate the world. Will this government support it? And finally, Mr. Speaker, I welcome what he said about research. Research and science is our way through this pandemic and is our way through to curing so many other diseases and ailments. But he will know that while we're in this pandemic and when GPs are stretched and frontline staff are stretched, patients are unaware that a whole load of GP-held patient data is about to be transferred to NHS Digital. Now, I am not opposed to NHS data being used for public good research, but some of the most sensitive personal data shared with GPs by patients in confidence several years ago, potentially when in a state of vulnerability, such as termination of pregnancy, matters of domestic or sexual abuse, issues of substance misuse or alcohol abuse, is set to be shared with NHS Digital and potentially used by commercial interests, and yet hardly anyone knows about it. And there are worries about safeguards, there are worries about patient confidentiality. So given the secrecy, given the haste, and given the difficulties in opting out, will he not now consider abandoning this, pausing this for now, and launching a transparent consultation process with patients and clinicians on how best confidential data can be shared for research purposes?
Secretary of State.
Right. Thank you very much, Mr. Speaker. Firstly, he raises the question of making sure that we reduce transmission amongst children. It is true that the increase in case rates has been predominantly amongst children, especially secondary school-aged children. The testing regime amongst secondary school-aged children has been enthusiastically taken up by schools across the country. It is very important as we return from half-term that is reinstated in full twice a week, every child being tested. It made a big difference in helping to keep schools open, both making sure that whole bubbles didn't have to go home, because if somebody tested positive at home before they went in, it meant that the whole bubble didn't have to go home. And also, of course, keeping schools open and preventing the transmission up to older age people who might be more badly affected. So the testing in schools is incredibly important to make sure that we can keep as much education as possible between now and the summer. He asks about the JCVI advice on children's vaccination. That will be available in a matter of weeks. I know that they're working hard on it now, and I'll of course come to the House, Mr. Speaker, and explain the proposed approach as soon as we have that formal advice. Finally, he asks about the use of patient data, and I'm glad that he said how important he thought research based on data is within the NHS, because it is life-saving, and it's been used incredibly powerfully during the pandemic. And in fact, one of the reasons that the UK is the place where we discovered some of the life-saving treatments for COVID, like dexamethasone, is because of the powerful use of data. In fact, the discovery, that discovery of dexamethasone, which was discovered using NHS data, has saved over 1 million lives around the world. Now, he also raised the issue of this data, he said belonging to GPs being passed to NHS Digital. The truth is, data about his or my or anybody else's medical condition doesn't belong to any GP. It belongs rightly to the citizen. It belongs to the patient. That's the approach that we should take. And I absolutely agree with him that it's important to do these things right and properly, but I'm also very glad that the vast majority of people are strongly on side for the use of their data to improve lives and save lives, and that's the approach that we're going to take in building a modern data platform for the NHS, so that we can make sure we use all of this modern asset to improve individuals' care and to improve research and therefore all of our care, whilst of course preserving the highest standards of safety and privacy, which will be enhanced by a more modern use of data. So I'm glad he's on side for the use of data in the NHS, but you have to be on side when you actually put that into practice. It's not just warm words, Mr. Speaker, it's about making it happen.
Chair of the Select Committee.
Thank you, Mr. Speaker. It is incredibly encouraging that just 3 cases out of 12,000 cases of Delta variant were double jabbed. But is the debate inside government now about a potential short, temporary extension of the restrictions to allow more people to get both jabs, or a more permanent slowing down of the easing of restrictions? Because that is a massive difference to all of our constituents in terms of what may happen in the announcement next week. And secondly, could he look at one particular group that have been very hard hit over the last year, which are the parents of disabled children? He will know about my constituent Laura Wilde, who took her 9-year-old daughter who has cerebral palsy to Lanzarote for physio she was unable to get in England, and is now looking for flexibility in the quarantine rules for when she comes back. Can we show more flexibility in exceptional cases like that?
Chair of State.
Well, on the latter point, on the case of Laura Wilde, my right honourable friend's constituent, I'm very happy to look at how that case can fit with the exemptions that do already apply for travel for medical purposes, along, of course, with the testing regime to make sure that that's done in a safe way. And I'm very happy to talk to colleagues at the Home Office about allowing that to happen. When he cut on his first point, it is reassuring that there is such a clear breakage of the previously inexorable link from cases through to hospitalisations, and that is very good news. And this is why we have this race to get everybody vaccinated as soon as possible. Speaking to those directly, if I can address, Mr. Speaker, those people in their late 20s who will be able to book a jab from tomorrow, and others who might feel that in their age group they're unlikely to die of COVID. The honest truth is the best way for us to get our freedoms back, get back to normal, is for everybody to come forward and get the jab. It really matters that we all come forward and do this, because that is the safest way out. On the specific question he asked about how we're thinking about the 21st of June step 4, not before date, the honest answer, which I will give to any question about this, is it is too early to say. I tried to give a studiously neutral answer on the TV yesterday, Mr. Speaker, which some people interpreted as gung-ho and others interpreted as overly restrictive. That is the nature of uncertainty, I'm afraid. It is too early to say. We're looking at all of the data, and the roadmap itself sets out the approach that we'll take, which is that there is step 4, and then there are 4 distinct pieces of work which are reports on what should happen after step 4, on social distancing, on international travel, on certification and the rest. And we will assiduously follow the roadmap process that has been set out, with the 5-week gap, 4 weeks to accumulate the data, then take a decision with a week to go, and we will come forward. The Prime Minister will ultimately make those decisions and come forward and announce them in a week's time.
Let's go to SNP spokesperson, Dr. Philippa Whitford. Philippa.
Thank you very much, Mr. Speaker. I note the Secretary of State is still considering ending all social distancing measures on the 21st of June. But does he not think that would be dangerous in the face of rising cases of the significantly more infectious Delta variant? Would it not be better to actually adhere to the government's mantra of being guided by data and not dates? While it's welcome that half of adults are fully vaccinated, and Scotland has already started vaccinating those over 18, he must be aware that 1 dose of the current vaccines only provides 33% protection. So does he accept that means we can't rely on single-dose vaccination to control this variant without social distance measures? Myself and many other MPs repeatedly called for hotel quarantine to be applied to all arrivals in the UK to prevent exactly the situation we now face. He repeatedly claimed home quarantine was working, but does he not accept that the importation and now dominance of the Delta variant shows that isn't true? With the current rise in cases of the Delta variant threatening the progress made during almost 5 months of lockdown, does he regret the decision to delay adding India to the red list? In light of the disruption caused by the shambles of changing Portugal's classification this week, does he recognise that this has done neither holidaymakers nor the travel industry any favours? So will he now get rid of the traffic light system and tighten border quarantine policy so we avoid importing more vaccine-resistant variants and safely open up our domestic economy and society? He talked today about the UK vaccinating the world. So can he say how many doses the UK has donated to COVAX? And does that mean the government will support the sharing of intellectual property and technology and the TRIPS waiver so as to increase global vaccine production?
Well, there's quite a lot that needs sorting in that. The first thing I'd say is this. She complains that I acted on Portugal when we saw the data, and yet she complains that I didn't act on India before we had the data. You can't have it both ways. You can't have it both ways. She can't have it both ways, that she asked me to follow data, not dates, but then asked me to prejudge the data by making a decision about the 21st of June right now. I'm a bit confused about that one too, because I noticed that the Scottish Government have been themselves reopening. Now, that is a perfectly reasonable decision for the Scottish Government, But it's a bit rich then for the SNP spokesman to come to this House and have a go at us for deciding to look at the data over the next week rather than prejudging that decision. So it's quite hard to listen and not respond to explain what's actually going on. The third point I'll make is on international vaccination. Absolutely, this country has stepped up to the plate. Of the 2 billion doses delivered around the world, 500 million have been the Oxford AstraZeneca vaccine, which was developed by AstraZeneca Oxford and with UK government taxpayers' money. It is, as I put it in my statement, a gift to the world. And of course we don't rule out donating excess doses as and when we have them, but only when we have excess doses. And I'm sure that she will accept that that is a position agreed not only by the UK government, but also by the devolved administrations, because we all want to make sure that the people who we serve get the chance to be vaccinated as soon as possible. So that is our approach. And finally, when it comes to intellectual property, Mr. Speaker, we support intellectual property rights in this country. You couldn't get drugs to market in the way we managed to without support for intellectual property, because you have to put billions of pounds of research often in order to get the returns over the medium term. But what we did do was, more than a year ago, we agreed with Oxford and AstraZeneca there would be no charge for the intellectual property rights on this vaccine right around the world. Now, I'm delighted that others are starting to take the same approach. Last month, Pfizer announced that in the lower middle-income countries, it won't charge intellectual property. But we've been on this for more than a year now, and so it's a bit rich to hear a bit of a lecture from the Health Order.
Ewan Barrington.
Thank you, Mr. Speaker. Can I ask the Secretary of State about his department's role in the latest international travel restrictions? Firstly, what happened to the green watch list, giving more time to prepare for a switch to amber? Did he receive scientific advice that Portugal should be moved to amber? And if so, will he publish this advice? And has the World Health Organization recognised the Nepal Delta mutation as a variant? And can he confirm that there were just 12 cases of this mutant in Portugal and 3 times as many in the UK? And ultimately, can he give me a milestone for when we can unlock international travel, perhaps the double jabbing of over 50s and the clinically extremely vulnerable? Because without that milestone, it's difficult to see how we can ever give this industry and workforce hope for their future.
Secretary of State.
Well, my honourable friend rightly asked these important questions about the decisions that we had to take on Portugal. The truth is that we acted, yes, on the scientific advice, on the advice of the Joint Biosecurity Centre, based on the best information that we had in terms of this new variant, so-called Delta AW, because it is a variant on the Delta variant itself. And so we did take that advice. Now, restoring international travel in the medium term is an incredibly important goal that we need to work to. It is going to be challenging. It's going to be hard because of the risk of new variants, and new variants popping up in places like Portugal, which and have otherwise a relatively low case rate. But the biggest challenge, and the reason this is so difficult, is that a variant that undermines the vaccine effort obviously would undermine the return to domestic freedom, and that has to be protected at all costs. Now, thankfully, the Delta variant itself, after 2 doses, gets effectively the same coverage as the old Alpha variant, or indeed the original variant. So the fact that that is now dominant in the UK does not put our strategy at risk. It makes more of a challenge from getting here to there, but that is a challenge for this decision this week and how we handle things in the short term. It does not put the strategy at risk. A variant that undermined the vaccine fundamentally would put us in a much, much, much more difficult place as a country, and that's why we're being as cautious as we are.
Nero's.
Thank you very much, Mr. Speaker. As he has pointed out, as the Secretary of State has pointed out himself, Data has been key in the pandemic, and I agree with him, having previously worked briefly for NHS Digital, that data saves lives. I also agree with him that patient data belongs to the patient. And one of the things I learned during my time working in data is that public trust is key. So why will the Secretary of State not pause this data collection programme, out of which patients have to opt out by the 23rd of June, to mount a full public information and communication campaign and be really explicit about how people's really sensitive data might be used and by whom?
Well, we are explicit about that, and I appreciate what she said about the importance of data and data saving lives, and I agree with her about the importance of trust and bringing people with you. In fact, the large majority of the NHS are now actively enthusiastic about using data better, and I very much hope we can keep it that way, not least because everybody's now seen the importance of using data to manage a crisis. And one of the reasons that the vaccine success is rolled out so effectively is that the data architecture that underpins the vaccine rollout is extremely effective, and I pay tribute to the people who built it.
Let's go to Bob Blackman. Bob.
Thank you very much, Mr. Speaker. In Harrow, because of the Delta variant, we've had surge testing in our schools. 13,000 young people have been tested at school and 12,000 relatives at home. And this weekend, 3,280 vaccinations took place because we had 2 new pop-up vaccination centres for 18-year-olds and over. So will my right honourable friend join with me in congratulating the entire team who've made this massive project so diligently followed to enable people to be safe in Harrow, but also will he consider having further pop-up clinics for 18-year-olds so we can get everyone vaccinated as soon as possible?
Secretary of State.
Thanks very much. Well, I pay tribute to the team at Harrow, and especially on this testing expansion. He said that there were 13,000 pupils and 12,000 of their relatives, and that includes me, because one of my children goes to school in the Harrow area, and so we got our PCR tests at home. We sat round the kitchen table, we all did them together, and I'm glad to say, Mr. Speaker, they were all negative. It showed to me, it was like I felt like a mystery shopper. It showed to me how effective this surge testing can be in making sure that we tackle these problems. We've seen that surge testing can work. We saw it in South London where it worked. We've seen it in Bolton where the case rate has come down. It's been used in Hounslow. It's been used in other specific areas, and I'm glad that it's now underway in Harrow to try to keep this under control.
Jim Shah.
Thank you, Mr. Speaker. Can I thank the Secretary of State for his statement, as always. The Secretary of State has been clear in the approach been taken to the Indian variant, which is currently posing difficulties, and I would be anxious to understand the level of cooperation and data share with the devolved assemblies. And in particular, I'm aware that we are dealing with possible cases in Kilkeel in County Down in Northern Ireland, where 1,000 homes have been visited and 900 tests carried out by a specialised mobile unit. It is clear that the Indian variant problem must have a UK solution presented. Thank you.
Yes, he's absolutely right. We talk about this when the Northern Ireland Health Minister, the Scottish and Welsh Health Secretaries join me on a weekly call. We are acutely aware of the importance of tackling the Delta variant, as it's now called, and it's something we work very closely together on across the UK.
Teresa.
Will he confirm that what he said on the Andrew Marr show was not a change of policy, it wasn't a sudden retreat from the roadmap, and that no final decisions have been taken on what happens on the 21st of June? And will he retain, can we still hope, in particular, that events involving big gatherings, weddings, all these kind of things can start up again, because there are so many, these are so important both for our economy and jobs and for our quality of life?
Absolutely. As I said then, it is too early to make this decision. We've got to look at the data, and we'll announce the decision next week. But when answering a logical question of are you open to delay, if you haven't made a decision on whether to delay or not, by dint of logic, you are open to delay. That is, I think, a perfectly reasonable and logical answer to a question, but it's absolute classic, Mr. Speaker. A politician answers a straight question with a straight answer, and it causes all sorts of complications.
Perkins.
Thank you very much, Mr. Speaker. We have seen in the last year unprecedented restrictions on our freedoms for reasons that we predominantly in this place entirely understand. The pressure on our National Health Service, the escalating hospitalisations and death rate. Now, given the statistics that he's just published and the tremendous success of the vaccination programme in preventing hospitalisations of people doubly vaccinated, can he just explain what additional freedoms are won for those people and whether we should be now considering whether people who've been doubly vaccinated should be able to get additional freedoms, given that it appears that they are not the cause of large amounts of hospitalisations in the future?
Well, the honourable gentleman is obviously a mentor of the former leader, Tony Blair, who was making this case at the weekend. What I'd say is we are looking into this question on certification. It will be necessary for international travel. However, in this country, we have moved together with everyone being treated equally in the same way that the virus treats us equally. I would note that in Israel, where they did bring this proposal in, they have also now